Alright, this is PAC 365, myself Srija. So today in this session, you are going to learn about the ICD-10 coding guidelines for diseases of the musculoskeletal system. So in this session, you are going to learn about how the codes are classified, how the diseases of muscular system and the skeletal system are coded. Okay? Yeah. So ICD is nothing but the international classification of the diseases. So this section of ICD-10 deals with muscles, bones, joints, tendons, ligaments, and the other structures that support the body movement. So how musculoskeletal conditions are organized in ICD-10 So how to choose the correct code? So what are the important guidelines like laterality, site, acute versus chronic, cause, manifestations, etc. So how coding rules apply, such as using combination codes, selecting the affected site, and identifying the underlying cause. So all these you are going to learn in this video. So chapter 13, it includes the diseases of the musculoskeletal system and connective tissue. So this codes ranges from M00 to M99. So what is the first guideline? The site and laterality. So what does site mean? Site refers to the specific anatomical location. So it involves bone, joint, and also muscle. Okay. So in ICD-10 chapter 13, most of the codes tell you exactly where the problem is. For example, M17.11. So it's a unilateral primary osteoarthritis, right knee. So here the site is right knee. So then the laterality. So what do you mean by laterality? Laterality means so which side of the body is affected, whether it is right, left, bilateral or unspecified. So the ICD-10 prefers specific laterality when documentation provides it. So if the provider does not document the site, you must assign as the unspecified, but this should be avoided. Multiple sites involvement. So some of the musculoskeletal conditions, they affect more than one bone, joint or muscle. So there will be two possibilities. So one is if a multiple site code exists. So some conditions already have a multiple sites option. For example, osteoarthritis, it affects many joints. So codes like M15.0, it is a primary generalized osteoarthritis cover multiple joints. So the second condition is when there is no multiple site code, you must assign the separate codes for each side. If osteomyelitis affects right tibia and also left femur, so you code each side separately because there is no single multiple site code exists, right? So this is the guideline regarding site and laterality. And the next is bone versus joint. So this is the important coding distinction. So some diseases affect bones while others affect the joints, even if symptoms appear similar. So examples where the bone itself is affected: for osteoporosis, nothing but you assign the code MEIT and MEIT1. Coming to osteonecrosis is MEIT7. So this may affect the upper or lower end of the same bone, but ICD-10 wants you to code the specific part. So this matters because the treatment and prognosis differ based upon the exact part of the bone involved. So site and laterality is most important in the musculoskeletal coding because it is designed to support the accurate medical records. You have to use exact site and the exact laterality codes. So understanding the difference, that is acute injury versus the chronic condition. So acute trauma, what is acute traumatic conditions? So these are the recent sudden injuries caused by trauma. For example, a fall causing a new ankle sprain, a fracture from a car accident, and a rotator cuff tear that happened yesterday at the gym. So you have to use chapter 19 injury codes for current injuries. So next, coming to the chronic or recurrent conditions, these occur when the patient had an injury long ago, but he is now experiencing the long-term consequences, or the patient has a condition that keeps coming back, always back. So that nothing but a recurrent. For example, if you take an old knee injury, now the chronic knee pain or osteoarthritis. So what you have to do, you have to code chapter 13 codes. So back pain due to an old heel vertebral fracture, you have to code chapter 13. So you have to use chapter 13 codes M00 to M99 whenever the problem is a long term, a result of an old healed injury or reoccurring in the nature. So bone, joint or muscle conditions that are a result of healed injury are usually found in the chapter 13. So this means if injury happened in the past and has already healed, but the patient now has a long-term effects, you have to code the chronic condition but not the old injury code. So real life scenarios for you. When we take a scenario of a new injury, a patient twisted their knee yesterday. He got an acute sprain. So you have to quote from chapter 19, SCIT 3, that is for knee sprain. If there is a pain from an old injury, if a patient fractured their ankles 5 years ago, but now he has a chronic pain, you have to quote from chapter 13. So this is the important coding guideline. Any current or acute injury should be coded to appropriate the injury code from chapter 19. You have to do not use N codes chapter 13 for a newly occurring trauma. So if it is difficult to determine from the documentation, you have to query the provider. So if you are unsure whether the problem is new, old or recurrent, you have to query the provider or you have to ask the doctor, but you have to never guess, you have to never assign the incorrect coding. So coding of pathological fractures. So this is also the important guideline. So coding of pathologic fractures, nothing but it indicates the seventh character. So seventh character, A, it indicates the active treatment. So use A when the patient is undergoing active treatment for the fracture. So what count as an active treatment? The surgical treatment, emergency department treatment, initial fracture care, casting, immobilization, etc. So even if the patient switches the doctors or hospitals, you have to still use A as long as they are still in the active treatment phase. So the seventh character is based upon the stage of healing, but not on whether the provider is seeing the patient for the first time. So this is about the character A. So the next to the seventh character D. D is nothing but the subsequent encounter, the routine healing. So you have to use D whenever the active treatment is complete. So the patient is now in the routine healing or the recovery phase. What are the examples of D phase visits? The follow-up checks, adjustment of cast or splint, routine healing assessment. So this is a normal follow-up stage, nothing unusual in the healing processes. So there are other seventh characters healing with the problem. So in the tabla list, ICD-10 gives the specific seven characters for complicated healing. So what are those examples? Include malunion, non-union, delayed healing and other sequelae. So what do you mean by malunion? Oh, this is when the bone heals in the wrong position, whereas non-union when the bone fails to heal, and delayed healing and also the other sequel are nothing but the long-term consequences after the fracture has healed. So these characters, they helps to document faulty or prolonged healing. So what are the complications of the surgical treatment? So if the patient develops a complication from surgical repair of the fracture during healing, what you have to do? You should use the complication codes. You not just the fracture codes. You have to use the complication codes. You have to refer the section IC 19, that is the coding of traumatic fractures for the guidance. So even though it is a pathological fracture, complications follow the trauma fracture complication rules. So this is about the active treatment, subsequent encounter and problems during the healing. So next guideline is about osteoporosis. So what do you mean by osteoporosis? Osteoporosis is a systemic condition, meaning it affects all the bones in the body, not just one specific bone, because this affects the entire skeleton, right? If ICD-10 CM codes, it does not assign the site-specific codes for osteoporosis unless a current pathological fracture is present. So for MEIT1, you have to MEIT1, what is MEIT1? It's a osteoporosis without current pathological fracture. So here the site doesn't matter. But for MEIT, the site refers to the fracture location, not the disease. So this is the difference between how would you code the site or how would you code the current pathological fracture site. So next one is osteoporosis without pathological fracture, the M81. So you have to use this, you have to assign the code M81 whenever the patient has osteoporosis but no current fracture. So even if they had fractures in the past due to osteoporosis, for example, a patient today has osteoporosis but no active fractures. You have to assign the code from M81.0 to M81.8 code range based upon the type. So what if the patient had a fracture years ago? You have to use a status code to show the history of an osteoporosis related fracture. You have to assign Z87.310. So what does it denotes? It denotes the personal history of the healed osteoporosis fracture. So this code is added after the M81 code. So osteoporosis itself, it does not have a specific site. So because it affects all the bones, the code does not specify whether it is a right arm, whether it is a left arm, whether it is a hip or spine, etc. So only the site only matters if there is a current pathological fracture. So if there is a fracture now, you shift to MEIT and the site describes the fracture location, not the osteoporosis. So past fractures do not change the code. Whether it is a old or a heel fracture, you have to use the history code Z87.310 but not the M80. So this is about the osteoporosis without pathological fracture, and then osteoporosis with current pathological fracture. So what this section means? So this part, it discusses how to code osteoporosis when the patient currently has a pathological fracture. So a fracture caused by weakened fragile bone due to osteoporosis. Osteoporotic bone, they can break even with a minimal trauma such as twisting, bending or a very small fall. So category MEIT, it is used when the patient has osteoporosis and they currently have a pathological fracture at the time of their medical encounter. So you must always use MEIT whenever a fracture occurs in the osteoporotic bone, even if the injury seems minor. Reason, what is the reason? In normal healthy bone, such a minor injury would not cause a fracture. So the fracture is considered as a pathological but not the traumatic. So what the MEIT codes tell us? So the MEIT codes specify the site of the fracture, the type of osteoporosis. So what is the site of the fracture? For example, MEIT 0.051A. So this is the code which describes the age-related osteoporosis with female fracture, that is the initial encounter, as the seventh character is A. And MEIT 0.031D. Here the seventh character is D, that subsequent encounter, and osteoporosis with humerus fracture is a description of the code. So these MEIT codes also tell us about the type of osteoporosis, such as whether it is a age-related osteoporosis, whether it is a drug-induced or post-menopausal or other secondary causes. So it also tells us about the encounter type, nothing but the seventh character. So what is A, what is D, what is S? A is nothing but the initial encounter, that is active treatment. D is a subsequent encounter, and S is the sequela, nothing but the long-term complication such as a chronic pain. So what is the important rule you have to remind? If a patient with osteoporosis suffers a fracture, even for a minor trauma, you must code it as a pathological fracture, M80, not as a traumatic fracture. Just this is most important rule over here. So next, multi-system inflammatory syndrome. So this briefly mentions this condition. So if the patient has the multi-system inflammatory syndrome, nothing but MIS in the short form, you have to, this is separate from osteoporosis coding, but this is included as a part of the overall musculoskeletal guidelines. You have to follow the guidelines which are present in the section IC1 G1I in the ICD-10 CM book. Okay. So this is about the guidelines of the ICD-10 CM for diseases of the musculoskeletal system. So now let's talk about the medical terminology of the diseases of musculoskeletal system. So it includes bones, joints, and also the muscles, right? So to understand medical terms related to the system, you have to learn how words are built using prefixes, root words, and suffixes. So you know about the root words. So important root words are, so below is a breakdown of the root words from the slide. So with extra information, explanation to support for you. So what are the root words over here? Osteo. Osteo means, it does mean bone. So what is the example? Osteoporosis is nothing but a weak porous bone. So osteo is one of the most commonly used root words in the bone related diseases. And then is ossi. Ossi means it also gives the bone. So ossification is the process where cartilage turns into bone during the growth. And next, spondylo root word, what is the meaning? Vertebra. What is the example? Spondylitis, nothing but the inflammation of the vertebra. And then costo is nothing but rib. Costochondritis, it's an inflammation of the rib cartilage. And cranio means a skull. Example, craniotomy. Tomy means it's a cutting or incision, right? So it's a surgical opening of the skull. So often done during the brain surgery. The other root word is mandibulo. Mandibulo means a mandible, nothing but a jaw. So mandibulectomy. Ectomy, it's a surgical removal. So mandibulectomy, it refers the removal of the jaw bone. And then maxilla, it's the upper jaw. Maxillitis is information of the upper jaw. So these are the roots of the musculoskeletal system. And coming to joints, what are the root word? Arthro means joint. What is the example? Arthritis, it's a joint inflammation. Bursa, bursitis. And chondro means cartilage. Example, chondromalacia. Malacia means softening of the tissue. Nothing but softening of the cartilage. And synovo or synovio, it's a synovial membrane or fluid. Synovitis, it's an inflammation of the synovial fluid. So these root words are mainly used in the medical terms related to joints, bursa, cartilage, and also the synovial membranes. And then muscles, root words related to the muscles, tendons, fascia, and related tissues are given here. Myo meaning muscle, and myoso is also muscle. Musculo is also a muscle. Fibro means fibrous tissue. Tendo or tendino means a tendon. Fascio means fascia. So these are the examples of these root words. And then next, coming to the common suffixes. So what are the common suffixes? So medical suffixes are word endings that tell you what is happening with the body part. So below it's a simplified breakdown of each suffix. So what is the suffix here? Itis, it's nothing but the inflammation. Algia, pain. Dynia, pain. Ossus, condition. Pati means a disease. Plasty means surgical repair. Otomy means incision. Ectomy means removal. Meniscectomy, nothing but removal of the meniscus. So this is it meaning the fusion. Arthro disease. So arthro disease is nothing but the two bones or joints are joined together permanently. So next is Malaysia, it's softening. Chondromalacia, it's a soft cartilage, right? So it's a softening of the cartilage. So this includes the abnormal softening. So this is about the common suffixes of the system. And then common prefixes. So what are the prefixes? These are the short word parts added to the beginning of a medical term. So they help to describe location, amount, or condition. So below are the prefixes. So what it is? Peri means around. So example, periosteum. And what is the meaning of the word periosteum? It's a layer around the bone. So you have to think of a peri as a circle around something. So the next prefix is inter, nothing but it's in between. So example, intervertebral. So it is located between the vertebra or the spinal bones. And sub means below. So subcutaneous, beneath the skin or below the skin. Hyper meaning is excessive. So what is the example? Hypertrophy, nothing but the muscle enlargement. So the increase in the size. Hyper is too much or overactive. And the last prefix is hypo. Hypo means not enough or low. It is a below normal. What is the example? Hypotonia. Tonia means a tone. So it's a low muscle tone. So this is about the prefixes of the musculoskeletal system. So this is for today's session. I hope this session has helped you. So in the next session, in the next coming session, you are going to learn about the ICD-10-CM code classification for the diseases of the musculoskeletal system. So you will be learning about the clear-cut code classification and how the codes are classified. Thank you.